You definitely want to use some of these tools that have been developed, the NDIs, the oswestry. There are different questionnaires for upper extremity, for the knee. You know, if you're doing extremity work, if you're doing more functional rehabilitation and those types of things, you want to use these instruments that have been developed. They've been established as valid documentary evidence of functional loss, functional assessment. And what do we really have once the pain's gone in 12 visits, 10 visits, 8 visits, 30 visits? What do we really have? We have the relationship between how they function in their environment. So we have to know how to use these. I will tell you that to try and get somebody to fill out an NDI, an oswestry, a new history, a pain diagram, you know, sign a HIPAA release, you know, that like 12 pages of stuff day one, it's way overkill. It's overwhelming. So you might have to filter these things in over a period of time if you're going to use them. Just be mindful of that. You definitely also want to understand fully that this data that you're gathering is to be utilized as a starting point to dive in, right? It's not necessarily going to be the end all. And unfortunately, some of you have, you know, gone to a program, you've absorbed some system perhaps, and many of these systems out there, whether they're computer-based, paper-based, they're really limiting. They put the patient into a slot, and you're like, oh good, history's done, that's done, file that, move on to the next thing, without diving in and really analyzing that information. And if the structure of that particular system you're using is very tight, it doesn't leave any room for you to, you know, bring the emotion and the human element into it. Might be worthwhile for you to fill out your own paperwork, mind of the patient again, see how long it takes you, see how you feel perhaps when you're filling it out, just to get an idea. You know, what are they, you might even analyze the questions a little bit if you've developed your own forms and refine them over time. You know, I used to keep a folder, and once a year I'd review all my forms, and during the weeks and months that you'd process new patients and so forth, if I saw a question that I was constantly having to clarify, or like they were like, I don't understand what you're meaning by this or something, I'd circle it in red, right? And then once a year I'd go through and fix it. If it was an egregious mistake, then I'd fix it right away. But over a period of time, right, the language changes. I mean, we didn't have tweeting and texting and all these kinds of things 5 years ago, not like we do now. So we have to be contemporary with the questions we're asking and how they're interpreted by the people. So be mindful of that. Okay, that completed history form, right, it's only a starting point. They basically have answered a set of structured questions. And again, if they're open questions and you're getting the kind of data you want, marvelous. If they're not, let's reshape them, okay? You've got to get past the superficial business that most people operate in. You really do. And the faster you can do so, the better. Now, many of you will say to me, listen, I want to see 250 visits a week. That's my goal. Let me tell you something. It's not like seeing 100 visits or 200 visits is twice as difficult as seeing 100. It's about 4 times as difficult. To see 300 is about 10 times. To see anything over 400, 500 visits, and there are some people that can do this, understand something. It takes a skill set and incredible focus and efficiency. You have to develop the skills internally. Okay? It's like, I want to run a marathon. Well, I'm in pretty good shape. My heart rate's pretty good. What the heck? I'll go do that. Versus you run a little, you know, there's programs out there, you go a mile, then you do 2, and then you do a 7, and then you come back and you got to do that with practice, you know? You've got to develop these skills, and you have to eliminate all kinds of external distractions. One of the things you have to be able to do is become incredibly skilled at piercing this superficial shell that people have quickly. It might take you longer. So if you're in a volume situation where you're not where you'd like to be really, you want to help more people, fine. Develop these skills. It's the people skills that are going to get you where you need to be. According to the Journal of the American Board of Family Practice, some key points here, and I reference this study for a couple reasons. One is listening and how important that is. If you're just spewing your agenda from the minute the person walks through the door, not such a great idea, okay? It's also not what you say that's important so much as it is what they hear, right? It doesn't really matter what you say if they don't hear it, or if they can't reiterate it, or they don't understand it, okay? The other thing is that summarization is a skill that you have to really work on. So if you take from this presentation, if you just take a couple things, one, the first impression really matters. Preparation is essential, and how you gather the information. But the skill set for the doctor is how do you summarize what the patient tells you. Okay. Lastly, please I'm just as excited as you are about the volumes of research being done in chiropractic. I was involved with this ICA project of, the guidelines and the X-ray guidelines, and I mean, I'm thrilled to be able to say that I could help contribute to that, to compile literally all the research and create this great database to refer to. Problem is, as excited as we are, you cannot spew that to people. You can only reference it in simple ways because it's a big turnoff. People don't get it. You really have to avoid this. You're going to go to many seminars, and I encourage you to continue to invest in your education, invest in yourself, invest in those things that are going to broaden your mindset, okay? But understand something. You're going to be presented with platforms, with agendas that may not really be your own. If you get a gut check because some consultant or some practice guru, management guru, whatever, tells you, hey, this is how you get to 300 visits a week, and you get a little like, geez, I don't know if I could do that. Don't. You're adopting somebody else's agenda, right? It only matters what you do and what you're comfortable with. If you're going to develop a profitable long-term business, you got in this presumably to help people. If you're going to do that, guess what? You got to invest the time, and it doesn't happen overnight, okay? Before you enter the room, okay, you're going to take this piece of paper and you're going to review it. You're going to review what they've said, okay? You're going to review the responses. You're going to gather your thoughts, and you're going to prepare for this summary that you're going to provide. Very critical for you to do that. You're going to reflect on what you know about this person. You're going to review what your assistant or your interns or whatever put down on this new patient information sheet in detail. Where do they work? Are they married? Are they single? All of the details that you can, and congeal those into something that can enable you to present in a logical way, but yet and more importantly, in an emotional way that the patient can relate to and understand. Okay? The history form, pick any of you could do this, but analyze this thing, There's all kinds of clues on it. For instance, this one, this happens to be a real person who it's kind of an interesting story. I had an assistant, her name was Yanula. And I said, Yanula, I want you to fill this out. I know you have had some problems in the past. I want you to fill this out for real, but I don't want you to use your real name. She goes, oh, okay.